Hello, everyone. Thank you all so much for joining. On behalf of the University of California Center for Climate Health and Equity, our EcoHealth Center, the UC Climate Change and Mental Health Council, we welcome you here today. Our webinar series on urban wildfires is co-hosted by the UCLA Center for Healthy Climate Solutions, the Jonathan Fielding School of Public Health at UCLA, the Sustainable LA Grand Challenges, the UCSF Alumni Association, and the communications teams at UCSF and the UC Office of the President. So while the LA and Southern California wildfires have now been contained for several weeks, I just want to remind you that they together burned nearly 60,000 acres, which is around 90 square miles, and damaged and destroyed many structures. Tragically, 29 people lost their lives, many more were injured, and many people had to evacuate their homes. So throughout this 6-part wildfire series, we've explored the many ways that wildfires can affect people's lives, from their physical and mental health to neurocognitive and development impacts. We've also looked at different groups like children, adults, and the elderly, and how they may experience these effects in unique ways. Beyond individual health, we've also examined broader social and community impacts, such as migration and displacement, job loss, food and water insecurity, food and housing insecurity, and also water insecurity, and how communities can really rebuild and recover after these events. So to wrap up these series, we want to turn our attention to wildfire policy, since policy plays such a critical role in shaping our health outcomes. So as wildfires, continue and worsen across northern, southern, and central California in the coming years, strong policies for prevention and mitigation will be more important than ever. So by focusing on these proactive strategies for wildfires, we hope that we can shape a safer future for everyone that is at risk. So this session really comes at an important time to discuss wildfire policy. So this follows last week's Climate Resilient California and Californians Summit, or the CRC2 Summit that many of you may have attended, that brought together leaders from across California, nationally and globally. And the event was really sponsored in support of the Pontifical Academy of Sciences and Social Sciences Global Initiative from climate crisis to climate resilience. So Ram Ramanathan, who is a world-renowned climate scientist from UC San Diego and a key leader of this initiative, was originally scheduled to provide an overview of the conference's key takeaways, but unfortunately, due to unforeseen circumstances, he's unable to join us today. So before I turn it over to the speakers, I just wanted to highlight some key points and themes from CRC2. So the conference emphasized the MAST framework, so a comprehensive approach that integrates mitigation, adaptation, and societal transformation to address the climate crisis effectively. And a major focus, and we've been discussing this here, is the role of local and regional leaders in shaping climate resilient policies in California, and also the need to engage frontline workers while at the same time prioritizing equity. One key outcome of this summit was the launch of the resilience blueprints, so designed to help California communities build resilience in a way that can serve as models globally. Specific to wildfires, the conference highlighted the urgent need for fire-safe reconstruction, resilient infrastructure, and equitable recovery strategies, especially in response to the recent LA wildfires. And to address these challenges, importantly, an independent commission was established to develop policy recommendations aimed at really accelerating safe and climate resilient rebuilding efforts. And experts at CRC2 also emphasized the importance of really expanding advanced firefighting technology, including using AI-focused early detection tools as a key to mitigating wildfire risks. So one of the sessions at CRC2 highlighted the crucial role of health and climate action. And at that session, we were able to share some insights from our UC-wide Center for Climate Health and Equity, where we recently underwent strategic planning with about 50 stakeholders across California. And through this effort, we identified 3 pillars for advancing climate and health across California. And these pillars align perfectly with the MAST framework that I've just reviewed. So for mitigation, we must drive transformative shifts to decarbonize our health systems and also quantify those health co-benefits of our mitigation strategies. For adaptation, we know that both our communities and health infrastructure need to be resilient in the face of these increasing climate health threats. And to support societal transportation, we do really need a health workforce that is prepared to lead on climate health and equity, and that can also advocate for policies that strengthen climate resilience. So by focusing on these pillars, we can ensure that climate and health remain at the center of California's response to climate emergencies, including wildfires. For adaptation, we discuss the importance of really reimagining both our health systems and communities to be prepared, equitable, and sustainable in the face of these climate threats, and particularly, in this case, wildfires. And as we've been discussing in these series, wildfires and other climate threats don't just endanger public health, but they also strain health systems and services. So, for example, we've seen that they can damage buildings and other infrastructure, and then disrupt clinical care through evacuations and power outages. Workforce strain can occur as providers face overwhelming patient surges. And we also see increased demands on health facilities to provide community support, such as shelter and food. So to build true climate resilience, we need to be shifting from reactive crisis management to proactive planning. And I think we're going to be discussing that today. So we need to anticipate the patients and services most affected, ensure that adequate resources are available, and synergize our efforts across community and health systems levels. And towards that end, in 2023, our center received a UC Office of the President Climate Action Award to develop clinical emergency response plans to mitigate wildfire smoke in the San Francisco Bay Area. So with the support of our many partners that you see listed on the right, we had 3 key goals. First, to identify populations at risk with much more granularity than has been done in the past. So we're doing this by using advanced machine learning techniques and creating vulnerability profiles to pinpoint those populations most at risk so we can work with those groups on interventions. Second, we're developing a comprehensive database and resource guide that outlines those organizations, activities, and strategies aimed at mitigating wildfire smoke exposure. And this guide is also going to be highlighting the barriers and facilitators to implementing effective health protective measures. And third, we're establishing clinical climate emergency response plans. So specifically, we're working with a coalition of stakeholders from UCSF Health and the San Francisco Department of Public Health to really align our emergency response grids and protocols so that all clinicians in the San Francisco County follow the same standardized emergency response protocols. And we think that this work can serve as a model for improving health system and community resilience to wildfire smoke across California. Now, with this context, let's dive deeper into today's discussion, and we have a great lineup of speakers today. Before I introduce our panelists, I want to remind you that our webinars are being taped, and the links will be sent out to all of those who signed up. And you're gonna find some resources on our website, which we're going to include in the chat. We hope that our center will continue to serve as a resource to our UC community and to others in California more broadly. Please disseminate the links to others who you think may be interested. And I ask you to pose your questions in the Q&A function on Zoom. And now it is my pleasure to introduce our first speaker, Forrest Schafer. So Forrest is the state coordinator of the Governor's Wildfire and Forest Resilience Task Force. This task force was created by the Office of Governor Gavin Newsom in 2021 to directly confront the threat of devastating wildfires and its far-reaching effects across California. Welcome, Forrest. We are thrilled to have you.
Thank you so much, Sheri, and I'm thrilled to be here. Once again, my name is Forrest Schafer. I'm the Deputy Director of the Wildfire and Forest Resilience Task Force. And what I'm hoping to cover today is first, a little bit of background on what's happening statewide relating to wildfire and forest resilience. And then I want to go specifically into the role of the task force and especially from a policy perspective, what kind of a role we play. This is a little bit different than most presentations I give, where usually I'm giving overviews of the task force and some of the activities happening statewide. And I'm excited for it because I get to get a little bit more geeky than I usually do. And I'm going to be referencing a lot of statute and specific policy. And actually, by way of introduction, where I thought I'd start, by way of introducing myself, is by sharing a couple of my favorite policies that relate to wildfire and forest resilience. I started working on fire district crews, and then later as a forester, working on community wildfire protection plans. And the policy that led to community wildfire protection plans is indeed one of my favorite pieces of policy ever. It's called the Healthy Forests Restoration Act of 2003. And I think Annie's going to share a link in the chat in just a moment. And what was so interesting about this piece of federal policy is it managed to create both regulatory, funding, and policy frameworks to help incentivize on-the-ground coordination and collaboration towards meeting the goals of protecting communities from wildfire. And back working in Lake Tahoe as a forester for a local fire district, we worked directly on this, and there's a couple key pieces that enabled. Number one, it really defined the definition of what the wildland-urban interface is. And it actually put the power in communities' hands to define where that boundary is. It also required federal agencies like the Forest Service to take into account the priorities and the needs that were identified in local plans when the Forest Service and other federal agencies are making decisions around where they're going to do projects, where they're going to invest funds, and so forth. And then finally, there was a great host of regulatory exemptions that have stemmed from community wildfire protection plans, recognizing that there's a broad base of community support behind the work that's identified to be accomplished. Then, the policy could make it so that there's quicker, categorical exclusions under the National Environmental Policy Act or other mechanisms to make that work be able to get on the ground faster with that broad base of community support. So with that, I want to go into a little bit around what the state is doing. And first off, it's been amazing to me being in this field for about 20 years, where fire protection and fire mitigation was a pretty small field. Really, the impacts affect everybody, and we're seeing many more groups and many more silos being broken down to be able to achieve the ends that we need to meet. We're seeing huge historic investments in this space. California alone, since 2021, has invested over $2.5 billion in fire and forest resilience. And over the next several years, through Proposition 4, the voter-approved climate bond, will be committing $1.5 billion more in this space. There's also been a similar increase in the amount of funding and resources and personnel and equipment available to fire suppression and emergency operations. And one of the key policy decisions around that work and around those investments is that those mitigation investments shouldn't just focus in one place. There's a three-tiered strategy to those investments, focusing within communities on actions like defensible space and home hardening and other actions that reduce the immediate susceptibility of homes to wildfire and also increase evacuation and other readiness procedures. Next is around those communities and what we call the wildland-urban interface, where large areas of forests, other vegetation meet with those neighborhoods. And then the entire landscape beyond, recognizing all of the impacts of smoke, the impacts to the places that we love to enjoy and recreate on, the places we depend on for ecosystem services and economic stability are all at risk from wildfire. And so all three of those were being approached simultaneously. And there's more projects happening throughout California than ever as a result of those investments. Since 2021, over 2,000 new projects have been initiated. These include things like community outreach and education, defensible space, strategic fuel break networks that surround communities and reduce fire behavior when a fire may approach, and then also these large landscape restoration projects that help restore forest and landscape health. That can include things, especially with prescribed fire. And this is one where I think California should be really proud of its leaps in prescribed fire. From 2023 to 2021, the state doubled the amount of prescribed fire it's doing across the state, from a little over 125,000 to now 250,000 acres in 2023. So with that, I want to go into the specific role that the task force plays. Governor Newsom formed the Wildfire and Forest Resilience Task Force in 2021 with kind of two key needs. The first was to help align the work of state, federal, and other agencies and organizations that are working on wildfire resilience, recognizing that as these investments grow, as these number of projects are growing, the risk of siloing and splintering off these efforts so that they're not well coordinated and aligned with each other grows. And so the task force has a key responsibility of helping to align, support, and report and monitor on the work that's happening across the state. The second piece, which is near and dear to my heart as someone who's been a local practitioner for many years, is to support the programs and policies that are tailored to the specific needs and risks of each region. And so just to provide a really clear example here, so many of the discussions in the public discourse around wildfire and wildfire risk have really been focused on forests, specifically mixed conifer forests in Northern California and the Sierra Nevada, where there is a really great role for prescribed fire to both help restore ecosystems and to help protect communities. On the other hand, if we go to a place like Southern California, where the landscapes, especially around communities, are dominated not by forests, but by chaparral, and chaparral that actually has seen too much fire rather than not enough, like we're seeing in our forests. It necessitates completely different strategies and priorities in those areas and in the areas where we saw the Southern California fires than are required by other places throughout the state that might be dominated by shrubs. And so that's one of the key policy challenges that we face in the state, where we, of course, would like to have really consistent frameworks and support processes and investments and grants that really help fit with everything in the state. But the state is so geographically and pyrographically diverse that there's no one set of solutions, with so many different fire histories, so many different types of ecosystems, and so many different types of community needs centered in each of these areas. And so that really is one of our most important roles as the task force, is to support those regionally tailored strategies. There's a couple of ways that we do that. First, we want to provide the tools and the resources to regions throughout the state that help enable partners on the ground to get their work done faster and more efficiently. One of the key ways that we're doing that is with the Interagency Treatment Dashboard, which is a multi-sectoral database to be able to track and report on the accomplishments and the treatments that are being done throughout the state, so that we can know if our work is being effective, but then at the same time to provide a really significant planning tool, because one of the most important things that we can do, whether it's for planning projects or for whether it's setting new policy, is to understand what we've accomplished and how well that is working. A couple of other ways that we work on that is through the Department of Conservation's Regional Forest and Fire Capacity Program, and we're sharing a link right now in the chat to that. And these are a network of regional priority plans that are being developed throughout the state, and that the state is looking to as those means to provide significant regional investments to these programs. And critically, what it allows us to do is to move beyond thinking of single purpose projects, really just focused on fire or fire behavior, and to think around the broad suite of benefits that these investments can provide. That might be things like recreation, biodiversity, watershed, including water security, economy, workforce, climate adaptation generally, and also public health. So at this point, I want to point to a couple key pieces of legislation that I hope you take a look at. One of the things we were discussing as we were prepping for this panel is the idea of big P policy versus little p policy. The task force, as an entity, we're really focused on helping different organizations work within their existing authorities and policies to be more efficient in their work. So it's really kind of that little p policy work. But what's really encouraging is that sort of work can lead to really significant systemic change in terms of that big P policy. So one of the pieces of legislation that did that was Senate Bill 456. Senate Bill 456 took the action plan that the task force created, which is really the result of different organizations working together to identify how they can be more efficient and how they can be more effective. But then after that plan was released, it was codified into state law under Senate Bill 456 as a way to take those kind of grassroots actions and really make them permanent, more meaningful, and bring the kind of policy support and investment support behind it that's needed. The next piece I want to touch on, especially given kind of the focus on public health and some of our speakers today, is another piece of legislation that's just been introduced. It's called SB 223, and we're sharing a link there in just a moment. This is called the Wildfire Smoke and Health Outcomes Data Act, and it directs the Department of Public Health to work with the task force and the Department of Forestry and Fire Protection to create a common data and health platform. Reaching across different sectors and being comprehensive enough to be able to really inform policy as well as tactical decisions around prescribed fire and wildland fire. And I point here because the intersection of public health and land management and wildland fire, to me, is one of those really ripe fields that we're moving into next, where we have been and will continue to be really dependent on groups like the Center for Climate Health and Equity and their partners that are helping to advance this work. So with that, I encourage you to go to our website and scroll down. You can sign up for updates to keep track on our upcoming meetings, presentations, and other work with the task force. Thanks.
Thank you so much, Forrest. That was such an interesting and needed perspective for this panel and really gives a lot of insight to us and a lot of enthusiasm about what California has been doing. So that's great. So it is my pleasure now to introduce Dr. Claire Brindis, who is a distinguished Emerita Professor of Pediatrics and Health Policy, also in the Department of Pediatrics and Department of OB, Gynecology and Reproductive Health Sciences, and the Emeritus Director of the Philip R. Lee Institute for Health Policies at UCSF. Dr. Brindis is an elected member of the National Academy of Medicine, serving as a council member from 2018 to 2021 and the vice chair from 2021 to 2024 of its council, and has been an incredibly valued senior advisor to our UC Center for Climate Health and Equity since its inception. So welcome, Claire. We're thrilled to have you.
Thank you so much, Sheri, and thank you to all of the wonderful staff and faculty at the UC Center for Climate Health and Equity. And I'm really delighted to be with my colleagues, Forrest and Dick. And my role in the next several minutes is to provide a framework for the wonderful presentation that Forrest just made for you. Next slide, please. And what I'd like to talk about is this policy cycle and connect the pieces that Forrest so beautifully articulated, as well as Sheri, on what are the elements for effective policy creation. Now, this circle is really actually a myth because life is not so regular in going into circles. There are many stops and starts. There are many iterative levels. There's many elements to continue to feed. There's sometimes elements that don't work. So please use this circle of life, of policy life, just as an opportunity to think in a holistic kind of way, expecting and anticipating that there will be changes. So next, let me tell you specifically about some of the components of it. First, we'll talk about advocacy and capacity. So one of the beautiful things that Forrest pointed out is how prepared individuals who are committed, passionate, dedicated to this very important area related to fire and forest, because long before the problem was recognized by California policymakers and legislators and US legislators, there was a cadre of people who had the capacity to really recognize what kind of expertise they needed, what kind of partnerships, collaborations did they need, what were some of the resources to them that allowed them then to use the policy window that some of the historical events, including historical events that recently occurred in Southern California, but obviously fires that we've had throughout California, getting them ready and ready to pounce in action to drive policy. Next. So problem recognition then becomes a very important step when people are beginning to recognize that this is a huge problem, whether you lived the orange skies in the Bay Area or whether you saw the destruction that occurred recently in Southern California, it really begins to shake and shape up the importance of really considering what do we do in this very complex issue? How do we go to it? How do we raise awareness among policymakers, among the public, we say, look, among all the competing demands on you, here is an issue that California, that the country cannot run away from. Next, this problem recognition becomes a very important step in helping individuals and legislators and others, which I'll talk about in a few minutes, is to be thinking about, okay, now that we have this problem, how do we go about setting an agenda? What's the saliency of the issue? Who is going to be driven or impacted or compelled to act among state policymakers, whether it's the governor's office, whether it's the assembly, whether it's the Senate? What do they need to have as data points and potential solutions at their fingertips? And as Forrest pointed out so beautifully, there are multiple ways of solving a problem. And there are times when you may need to go for a small, lower hanging fruit and making progress in advancing that policy as compared to going for the whole vision of what you'd like to do over the long arc of a problem. Building on a small piece can sometimes provide the momentum, can sometimes provide the opportunity for different types of allies to come together to try to establish the kind of agenda that we need in order to generate support. And in my experience, policymakers are often driven by cost return on investment. For every dollar that's invested in this, how many dollars do you get back? Sometimes they're very compelled by a particular story. Sometimes they're compelled by the opinions of an influencer. So those elements create the sausage of policy creation. Next. So if we have a policy agenda setting period, what are some of the policies that we want to propose? What are some of the solutions? And sometimes when we look at this arena, as Forrest pointed out, we look at a variety of spokespeople who can shape the agenda, who can say, look, these are some of the best practices that one community has been able to develop, or these are the effective practices that other states have developed, or what are the opportunities for us to build on what is already occurring in different components of our state? How do we piggyback on some of those initiatives to help leverage what is already in place? So for example, when Forrest talks about planning documents in multiple communities, how do we build already on the momentum that those planning documents occur? How do we build on what federal legislation or state or local legislation? What are some of the ways that we can overcome some of the silos that he spoke about? And really thinking about the policy formulation from a kaleidoscope of different approaches to the problem. So for example, we don't only think about fires and the smoke and air quality. We have to think about the recreation component. We have to think about other lifestyle elements that are affected by coming up with a multi-pronged policy formulation. Next is the area of policy adoption. So it's great to be speaking inside of Sacramento or Washington, D.C., but really what is important is to be thinking about how do we generate the support among other strategic alliances, both within state legislators or the federal legislators. What are some of the ways that we compromise in some of those ways that we can implement new policies? What do we need to adopt? And sometimes we compromise and have strange bedfellows in order to advance a policy. So we need to have the support for policy adoption from many individuals who come together because they recognize that there's a payoff for each of them to be involved in shaping and adopting this action. And again, Forrest pointed out to a great variety of very concrete examples that policy adoption doesn't happen overnight. He showed us over and over again how adopting one strategy in 1 year can then lead to a building and a leveraging of that step as we know better and we have more data and more information about what is important to highlight and build on what we've been doing. Now that we have built some self-confidence, agency to make progress and moving forward. The next has to do with policy implementation. And here is a very important step related to developing a blueprint for action. The plans that Forrest referred to become very concrete ways of operationalizing the intent and the desire that we're trying to aim related to the policy that we pass. Without that implementation step, then those policies are paper tigers. They just are not there. We can't use them effectively. And again, there are many examples that he pointed out how effective the implementation of the vision has been to help assure that California has been at the leading edge, at the cutting edge. And we know that people at the cutting edge sometimes get bloodied, but we have had the benefits of very visionary leaders who've been able to push forward to say the written policy gives us space to be able to move forward. Moving forward to policy evaluation, we need to be sure that we also build in a vigilance. That is, if you're putting in policies, we need to be sure that we have measurements and monitoring and being sure that no one tears down our policy actions. Next. So just a few more considerations, and then we'll have Dick present. I want to point out to the importance of windows of opportunity, such as what are the ones that we've recently have noted. And here I want to underline some points that Forrest raised earlier. What is a capital P policy? And that it includes legislative, regulatory, justice systems. But there's also formal P that occurs through professional organizations who work in accreditation. And I also want to point out to the fact that there are many other formal groups in transportation, education, employment, recreation that are also interplaying with creating formal policies. And let's contrast that next to small p kinds of informal. And that's where we operationalize the large policy into requests for proposals, memorandums of understanding, the rollout power that program managers have. And often that points out to the reality versus what is written. One big reality that I want to point out to is that just because you pass a law doesn't mean that there are adequate allocations of resources. And that's why Forrest and his allies keep coming back to the state legislators for thinking about what additional bells and whistles and pieces can be added. Next. So I want to point out who is responsible for policy? And I want to point out that it takes a village. It's not just government officials who are responsible for policy. It reflects all these constituent groups and the effectiveness of the way that Forrest has pointed out to the mobilization that has occurred, the mobilization that Sheri pointed out to many ways that we can make and have been able to make progress. Next. I just want to end by saying there are many implications for effective policymaker that I hope that you'll consider as you think about next steps. We need to really think about how do we incorporate learnings from what has worked, but also learn from what has failed, including considerations for our current policy environment. We need to learn from other policy fields beyond environmental health. For example, breast cancer or HIV and AIDS. We need to think about those levers of change and how do we increase the ability to be effective, and to be thinking about when do we abide by some policy political compromises, which allow sometimes for smaller actions that really in the long run can help us build and continue that momentum. And finally, we need to recognize that smaller models of change can be scaled from grassroots to treetops and back. Thank you so much.
Wow, thank you, Claire, for that really wonderful overview and making the incredibly complex process of policymaking very clear to everybody and bringing your great expertise. So much appreciation. And now it is my pleasure to introduce Dr. Richard Jackson, who is a professor emeritus at the Fielding School of Public Health at the University of California, Los Angeles. As a pediatrician, he has served in many leadership positions with the California Health Department, including the highest as the state health officer. For 9 years, he was the director of the CDC's National Center for Environmental Health and received the Presidential Distinguished Service Award. In October 2011, he was elected to the Institute of Medicine of the National Academy of Sciences. He's also been a wonderful supporter and senior advisor for our center. So we're thrilled to have you. Welcome, Dick.
Thank you, Sheri. And let me just check my sound. Am I okay?
Perfect.
What a pleasure it was listening to both Forrest and Claire. And you know, it's an odd gift of these disasters as you end up working with absolutely terrific people from other agencies, and you learn so much more than staying in your own little track. The other thing is Claire has articulated a lot of stuff that I learned the hard way with bloody knuckles even along the way, and that there is a conceptual framework that really works. Here's my big message, that we're facing multiple problems. I don't need to tell any American that. And the really good solutions have to solve multiple problems. And in the 20th century, we were very good at drilling down very narrowly at one thing at a time, and we had a lot of progress out of that. But thinking about how do we create multiple benefits is what I'm going to be focusing on. The other is that what we respond with, what we build, is social policy, and I call it social policy in concrete. Next slide, please. What I mean by social policy in concrete is that anything we build is going to be around for 50 or 100 years. Your great-grandchildren probably will be experiencing it. So as you think about your children and your grandchildren, what are the things that worry you? And because I don't have a lot of time, I came up with my family's list, which is, of course, we all worry about serious illness, the loss of loved ones. When you're young, you worry about income. When you're old, you worry about inflation. We worry about our communities and the degree of homelessness. And the fact, when I was doing research for this, the average American California income can give you a capacity to buy a house for $400,000. When has any one of you found a house that is for sale, or even a condo for $400,000? It's very, very difficult for our young people. Obviously, earthquakes. I live right near the the Hayward Fault in Berkeley. And then climate heating, which we've talked about in other sessions, but I will touch on a bit. I am really worried about the loss of our democracy. I'm worried about pandemics. I think the article in today's newspaper just about high-level bat virus research going on in BSL-2 and BSL-3 labs and not in BSL-4. And that's really a problem. And of course, war. Next, please. So I was going back and forth to Washington, D.C. virtually every week when I was at CDC, and discovered over time that there was a whole lot of public health going on in the Department of Labor and agriculture, in energy, commerce. And really what is our role in public health is to carry the public health message and empower our partners who have the enforcement and other kinds of capability to create communities and situations where people can be healthy. Next, please. I mentioned Berkeley. We had an enormous fire 101 years ago, took out about 640 structures, including the land that my house is on right now. My house was rebuilt about 10 years later. The students at Berkeley actually stopped the fire from burning the campus. They were dispatched across the campus and put out any embers that were landing in order to bring it to an end. Next, please. But the intensity of the fires over the last 100 years have become much more violent. And Santa Rosa Coffee Park was a subdivision. And if you look at the left picture, you'd think, oh, that can't burn. That's all spread out. That's not typical flammable density. And it's got green trees around it. It burned, this place burned through in about an hour. 3,000 homes were ultimately lost in Santa Rosa, with 22 deaths from that so-called Tubbs fire. Next, please. And you all know the biggest fire in probably American history in terms of lives lost and homes destroyed was the Camp Fire, so-called, that affected Paradise, California. 14,000 homes destroyed with 86 deaths. A negative on that one was there was one road going, there's one road going in and out, and the road going out to the north was blocked by the fire. And so there was a tremendous difficulty for people to get out. Next, please. And the fire I've learned the most about, because I was right here in Berkeley when it occurred, was the Berkeley Oakland Hills fire. My wife's best friend, she worked at Alta Bates Hospital. Her best friend and her husband were trying to get out of their house. They had two cars, so they decided each one to drive one separately. They tried one of them. She made a wrong turn. She was killed. She was one of the 25 deaths. There are a bunch of lessons about the layout of this neighborhood. It's in the hills. People have nice views, but people like living on cul-de-sacs. In New Jersey, we used to call them dead ends. And but having multiple feeder roads, and this happened in Pacific Palisades, feeding to one major exit means you develop tremendous congestion, particularly when fire trucks are trying to come the other way. There were big lessons from the Oakland Hills fire. Next, please. Here is one obvious: brush and flammable tree removal. This university spent $2 million removing non-native trees for this environment, namely the Monterey pines and the eucalyptus, both of which go up like tiki torches when they're exposed to any lower heat in the understory in the chaparral. The building codes had to change. You have to have a non-burnable roof. You have to have the eaves not hanging out so far that they catch fire coming up. You have to close the vents, or at least have in a way to have the vents not pull in the hot air, the flame, and the sparks, both for the attic and for the crawl space. You have to underground the utilities. It is ridiculous to have high voltage wires carrying electricity that might be powering some of the pumps that are pushing water at the same time. In the Berkeley fire, one of the lessons was uphill water storage. There were two quarries that were eventually turned into reservoirs as a result, because then if you lose power, you at least still have water pressure in the firefighting fire hydrant system. One of the lessons out of the Oakland fire was when we brought the city brought in 15 other fire departments to help fight it. They were different fire hydrant nozzles. So they had, some of the fire departments couldn't use their equipment with the hydrants that were in Oakland. And the public's got to know about this, and we've got to teach them. One of the building code issues, and my house was inspected, they want me to put in very thick double pane windows that can resist. And boy, putting in new windows, putting in new insulation, and removing all the wood cladding on the house, it'd be easier just to demolish the house and put up a new one. So these are very tough questions at this point. But a big leadership lesson, and really what Claire was talking about was leadership, is the need for unified incident command and communications. What does that mean? It means you can't have the fire department and the police department on different communication systems. That, by the way, is what happened in Washington, D.C. with the helicopter and the commercial aircraft. You have to have one on-scene commander. When I was at CDC, I was there at September 11th and had to go up to Washington. We had about 10 CDC people in New York and 10 in Washington. The entire incident command was moved to Pier 92 in Manhattan, in the Hudson River, and they had 200 computers and workstations up and running within 24 hours. And by the way, Mayor Giuliani has many aspects to his personality, but he did a very good job in that leadership role. DC was much more difficult to work with because there were 100 people in charge, which means nobody was really in charge. Next, please. This is my street out front. The road has been torn up 4 different times, twice for improving the water mains and connecting the laterals, once for the sewer upgrade and once for the gas lines from Pacific Gas and Electric. And every time I went out and said, "Are you going to underground the wires?" And they said, "Oh, no, that's a different person's job." That's a metaphor for what's going on in America under the vetocracy. And I'll come back and talk about the vetocracy. And look at what we've done to our sycamore trees, our larger trees. We put more and more high voltage over them and then have to cut back the trees again and again. Next slide, please. So this is the reality of my children. My boys were born after 1980. They've never lived in a colder than average year. My granddaughter, age 10, has lived in the hottest years ever recorded. And when you look at this, you go, oh man, that's really shocking. But in fact, this is just one frame in a movie that will continue to go out to the lifetime of all of our listeners, and it will continue to go up and up, particularly under the changes that are occurring in Washington, D.C. By the way, I doubt I can make a slide like this for 2025 with the layoffs going on at NOAA and elsewhere. Next slide, please. I can't talk about all the impacts of this heating, but one very vivid one for us is that there is more energy in the atmosphere, that's what heat is, and more water in the atmosphere because warm air holds more water, which means that our storms, we're now getting across the country once in a 100-year storms about every other year, every other decade, and once in 500 years storms in about every other month. Next slide, please. Every other decade. This is very costly, and one of the biggest fears of any homeowner in California and nationally really is the loss of their home insurance, their fire insurance, their flood insurance. And this number of billion-dollar disasters has been going up and up and up. I hope NOAA can stay on this in the future because my cousin in Asheville, North Carolina, up in the mountains, thought to be very safe. I thought she wouldn't have to worry about anything. And the river just gullied out her entire community of Schwanona. Next, please. So as we rebuild, and this is what Claire is talking about, we're going to have multiple challenges, and there are going to be 100 suggestions from the public about what they want, and the developers are going to suggest we can do 3 or 4, and we've got to think about solutions that can deal with all the things on the left: energy costs, carbon pollution, food, insurance, and isolation. But we've also got to have a target, and this is what Claire was saying as well, have a healthier and happier population. And we have toxic forces that we're up against, including racism, greed, the idea that building homes is entirely up to the home building industry and not viewing homes as a public utility, I think is a mistake. We're up against ignorance, we're up against pollution, and we have to leave a healthier planet for our children. Next, please. And poor people have been left out ever since the 1980, the Reagan election. You can see what's happened to the top 1% of households and after-tax income, and you can see what's happened to the bottom 20% of our population. You know all this, but always in these kind of development decisions, those who have the money have much more influence about what's going to happen. And we have to teach people and educate and reach out to those who are being disenfranchised as this goes on. Next slide, please. And one narrower takeaway, if I may offer it to you. I had the pleasure of chairing a committee for the National Academies on health impact assessment. This sounds rather wonky, but where I'm going with this is in my early career, I probably read hundreds and hundreds of environmental impact assessments. And they'd have 1,000 pages on everything you could imagine. And of that, only about 3 pages dealt with current health, future health, and how to optimize for the human population. And so uh, environmental impact assessment has been so constrained that we fail to really capture what is most important. And in fact, it's even worse than that because it's often used as environmental impact assessment to stop things that we really need, like the high-speed rail in California and the Wilshire Boulevard subway. It was held up for endless. That's what I meant about the vetocracy. More money's going into lawyers than it's going into anything else. I will stop and wrap up at this point. Next slide, please. So next, and that's it. Thanks. Thank you very much.
That was wonderful, Dick. Very insightful remarks. I invite all the panelists to join. And I'm going to start with a general question, and then we have a bunch of very specific questions from our Q&A. So first of all, if any of you or all of you can talk about what factors you think may have hampered us from making even more progress related to wildfire policy in California, and maybe what are the most critical and feasible next step solutions for addressing policy directions needed to reduce wildfires.
I'm going to just jump in first because America is very good at both, and the politicians are, with viewing with pride and pointing with alarm. And crises open the door of opportunity that people don't pay attention to. And over again, I've seen a politician turn around and say, you know, I said it was a bad idea 5 years ago and 2 years ago, and all of a sudden, your idea is a very good idea. And then they claim it's their idea. But I think we've got to make the most because the door of opportunity does not stay open very long.
Wonderful. Forrest and Claire, anything to add, or should I go to the next question?
I got totally distracted by the question and answer board that I was reading, and so I missed the question.
Maybe if you can, oh, sorry, go ahead, Claire.
I was going to say, I was going to jump in. The question for us was very much about what do we need for the next steps to be effective in this arena. And again, I think both you and Dick pointed out to the importance of building a constituency that are made up of non-traditional individuals. I think that's a very important factor. So in, the window of opportunity in Southern California, when you have movie stars speak about the impact as influencers in our country, or when I've done work in the area of childhood obesity and I get the Department of Defense speaking about the fact that their people who want to be soldiers are not fit enough, it's a very surprising kind of constituency building. And so I think one of the answers, Sheri, it's a very important question and multifaceted, is we need to broaden the power of marshaling different types of constituents who own this problem.
Claire, can I just supplement that a little bit, which is, it is very important that we simplify our language and don't talk in either legalese or technicalese. And it sounds easy. It is not, as you know.
Yeah, that's a great point. So I'm going to ask Forrest a few sort of policy questions that came up in the chat. And so somebody asked about CA AB 306 that would freeze all state county building codes in California for years. Another person asked about Fix Our Forest Acts, that this act erases restrictions on destructive logging practices that worsen wildfire risk. And then someone else talked about rebuilding with hempcrete as fire-resistant building material and carbon negative. Any thoughts about any of these kind of very specific policy questions and recommendations from our attendees?
Absolutely, and I'll be honest, I'm gonna have to pivot this question a little bit because we haven't taken any official positions as a state on either of the two pieces of state or federal legislation that were mentioned. But there are a couple of things I want to share. Number one, relating to building codes. I want to point, in case you haven't seen it, point everyone's attention to an executive order that was released back at the beginning of February, which is accelerating the state's efforts to implement new home hardening requirements, specifically relating to Zone 0, which is a non-combustible area. And experts agree it is the single most effective measure to reduce home susceptibility to wildfire and to embers, but is very, very far from being universally implemented. So in terms of where policy needs to go next, it's common sense, cost-effective procedures for actually reducing home susceptibility. We put a lot of emphasis appropriately on reducing fire behavior around communities, but there really hasn't been the same kind of conglomeration around common policies and needs in the home hardening and defensible space areas. So that's a really important area to go. I think I actually have the ability to share a link to that executive order with everyone, which I just shared out. So that's in relation to that building code piece. In relation to Fix Our Forests Act and other federal efforts to streamline and get, whether it's fuel reduction work or even whether it's logging relating to the recent Trump executive order that seeks to reduce barriers to timber production. There's also, I think, a recognition from the California administration on the need to move forward more quickly with important wildfire risk reduction projects. And so the next piece that I'm just going to point your attention to is an emergency proclamation that was issued just a few days ago, which suspends environmental regulations with some very specific sideboards and best practices that need to be implemented in an effort to get this work rolling out quickly. So just to those ends, I think we do see some alignment, despite political differences, et cetera. There's certainly alignment on some of the realization of the need to move forward really quickly with this work and to think around common sense processes to be able to get the work done more quickly.
Great.
Can I just mention that the value of the examples that both Forrest and Dick gives us is how important it is to keep watch over what's going on. Because even when you have an act or an activity, an effort, endeavor, initiative, there are people who want to tear down our progress. So be sure that you are keeping a strong eye on legislative and executive orders and really work on that. And secondly, be very cautious about fancy names for some of these acts that really are counter to what we need to do.
Wonderful.
And just to supplement that, I have to tell you that it is an American tradition to put something in place and then walk away and think it's done.
Very good point. Well, I was going to ask, we have such great questions, and we're going to have to answer them, unfortunately, on our website. So we will take note of these and provide answers. I think Forrest is typing up one or two right now. And on that note, I just wanted to thank our wonderful speakers and thank everyone for attending. I also wanted to thank finally a large team who made this webinar series possible. Just to name a few, the CCHE co-director, Ariane Tehrani, Alyssa Eppel, and Jyoti Mishra, Dick and Claire, who are here, David Eisenman, Tarek Ben Marnia, Neetha Thakur, Sigal Maya, Anne-Maurice Charlesworth, Jen Zakaris, and Annie Rosenthal. And this officially ends our 6-part webinar series on urban wildfires. I just wanted to let people know we still have a few more sessions on our Zoom mindfulness program at 7:30 p.m. in the evenings for a stress break. So please join us, and we're going to add some links here for the remaining sessions. And finally, please note that our center will be hosting a spring webinar series starting in April, focusing on climate impacts on health across medical subspecialties. And we're going to be focusing specifically on infectious disease, allergy, and immunology and cardiology. So stay tuned for more information. Thank you all so very much for being here. And again, thank you to the wonderful panelists.